He shortened her life. He took her right to choose her death away. And I just feel that Mount Carmel should have stopped him long before this happened.
Albert Belisari's sister Joanne was a companion nun, very active in her church. Of all the patients identified by the hospital as being tied to the overdose scandal, Joanne Belisari was among the first. She died in 2015 and was the first to receive 1,000 micrograms of fentanyl.
It looks and appears to me you had a rogue doctor, you had a breakdown in protocols in the hospital.
Albert says he feels let down that a Catholic hospital would allow something like this to happen.
They're saying it's comfort, but when Joanne, she was out of the comfort zone. She was going to die anyway. And he didn't even consult the family before he inserted the fentanyl.
That process in particular, Albert says, about the drugs being inserted, he claims was not explained to him.
I'm angry, we may have consented if he had asked, but he didn't. He just chose it himself.
Another patient, Jan Thomas, died 2 months before Joanne in March of 2015. She got 800 micrograms of fentanyl.
Okay.
Reliving the loss of a loved one has been difficult for a lot of these families.
It just rips the wound right open again, so it hurts a little bit more this time.
The patients' families hired attorneys who sued Mount Carmel and Dr. Husel in wrongful death lawsuits. They claimed the doses were grossly inappropriate and that the hospital was negligent. Husel's attorney and those for the hospital have argued in court filings that these patients were in very poor health, or in some cases dying.
If his intent was not to cause them death, his intent was then to do what? What was his
comfort care? Comfort care. I think it's important that everyone watching this understand that the patients that we're talking about are end-of-life patients. These people were being kept alive primarily due to the equipment in the hospital.
Prosecutor Ron O'Brien used an analogy to sum things up. He said Husel's actions were akin to blowing out a candle while there's still some wax left over. A grand jury indicted Husel on 25 counts of murder because 25 patients, according to O'Brien, received 500 micrograms of fentanyl or more.
I have found no one, nowhere, that says 500 micrograms of fentanyl is an appropriate use of fentanyl for treatment of someone being taken off a ventilator.
All of the patients were in Mount Carmel's intensive care unit, where Husel worked the overnight shift. Many families told us their loved ones were in bad shape, but they were convinced by Husel or others that their loved ones were dying or brain dead. Records show nearly all the patients got the drugs around the time their ventilators were being removed.
You know, you want to believe it's just a bad dream and that it's not true.
Lisa Coleman recalled a conversation she had with Dr. Husel about her father, Jim Allen.
He said, I can promise you that he will not suffer and he'll go quickly.
Did they tell you that Jim was brain dead?
They said he was in complete organ failure.
That's what they told us.
That's basically what they told us too.
Yeah.
After news of the scandal broke, the Centers for Medicare and Medicaid Services steps in, sending state health inspectors to the hospital to find out what went wrong. They find in 24 of the 27 patient cases they reviewed that Dr. Husel used an override function on a medication dispensing machine to essentially bypass the pharmacy and gain access to pain medications like fentanyl. To the families and their attorneys, this is proof that the hospital's internal safeguards were not working.
This proves their negligence. It just proves to me that they weren't watching the ship. The records should speak for themselves.
The hospital says it first learned of an allegation involving Husel's patient care through a formal report that it received around October 25th, 2018. But it didn't remove Husel from patient care until November 21st. And during that period, the hospital got additional reports, and 3 patients died.
We want to know what that formal report was. We want to know what informal reports they had.
reality would tell us that somebody in this 4-year period of time was saying something about this.
Was the hospital aware before October?
We've been discovering things all along as we've been learning through the investigation process.
But was there any chance to remove him prior to that?
Not before October, no.
It's only after these lawsuits are filed and CMS steps in that we learn from Mount Carmel that some of the patients could have seen their conditions improve with other treatment. And we start to hear from sources inside the hospital who allege that this tragedy could have been prevented.